Welcome to Psych Incubator and Eminent Psychotherapists Revealed. I'm Jeffrey Magnavita with my co-host, our new co-host, Heather Smith. We are pleased to have as our guest tonight, Dr. Mary Frances O'Connor, a neuroscientist and psychologist. Mary Frances is an associate professor of psychology at the University of Arizona, where she directs the Grief, Loss, and Social Stress Lab in investigating the effects of grief on the brain and the body. She earned her PhD in clinical psychology from the University of Arizona in 2004. I came upon Mary Frances's work when I was listening to Ira Flato's Science Friday, driving in my car, and I thought, oh my goodness, the work that you are doing is so amazing that we have to get you. And you were kind enough to respond to our inquiries and to take the time to join us tonight. So thank you very much for joining us. And we're going to talk about your work and your book, The Grieving Brain, The Surprising Science of How We Learn from Love and Loss, which I think is going to be very applicable to a lot of the people that will be watching our show tonight.
Thanks so much for having me.
Oh, it's our pleasure.
So my first question for you is, how did you get into this particular work, the work about grief, but also specifically the neuroscience of grief?
Yeah, neuroscience is not the first way you think about grief, certainly. But I think as I was coming up through a psychology undergrad experience, there was this amazing new machine called a functional neuroimaging scanner. And the idea that we could look inside the black box of the brain seemed just completely amazing to me. And it was very clear to me that, the brain has to encode the world around us, and that means it encodes our relationships. And so I was so curious about how it understands then when a relationship is broken. And so that's sort of the science-y side. And I think about not just what grief feels like, but why and how. And I think the brain can help us to understand maybe some of that. But of course, there's a personal side as well. We always have multiple motivations. I think that's something that clinicians will recognize. And so for me, it was that my mother was diagnosed with stage 4 breast cancer when I was 13. And she was only supposed to live through the year, which of course I didn't even know when I was 13. But I knew that there was a lot of grief that came, to our house. And she actually, her oncologist described her as his first miracle. She lived another 13 years, which is just phenomenal. And I feel very, very lucky. But it meant that in all of that time, I came to feel very comfortable with people who were grieving. And so as I was, doing my clinical graduate work, I just felt comfortable sitting with people who were grieving and then hopefully listening really closely to what they were telling me about their experience and trying to map that on to these neuroimages that I was seeing.
It's fantastic. So can you share some of your insights as to what you learned about grief, watching and sitting and being a part of this painful process?
Yeah, I think that initially people didn't really even understand how we could evoke grief in a neuroimaging scanner, right? Like, if you've ever had a scan on your knee or your heart or something, it's a very sterile medical environment. And we worked really hard to think about how could we evoke a real wave of grief while participants were in the neuroimaging scanner. And so we asked them to bring with them, when they came in to be interviewed, to bring a photograph of the person who had died, like you might show a photo album to someone. And we also asked them the story of what had happened when their loved one died, and chose sort of key words out of their narrative. And so what that meant was I was able to scan the photograph into a computer. And while they were lying in the scanner, they wore goggles so that they were seeing photographs of their loved one and the words that were, bringing up memories of the loss. And so that gave us an opportunity to see what parts of the brain were activated as they were going through this wave of grief. And I think that one of the most surprising things, not even in the first study, but in a second study that we did, was that there is a specific part of the brain that is associated with that experience of yearning. So that just wanting that person to be back. And what we saw was this particular region, which is called the nucleus accumbens, which is not important unless you like to collect brain areas, So the more activation that we saw in that brain region was associated with the people who told us they had more yearning, that there was a, direct correlation there, not time since loss or anything.
How did they describe the sensation of yearning?
Yeah, so it was part of a set of questions that we asked. And it was really a very basic question. Tell me about how much you've been yearning. And they were actually giving it to us on a scale, a numerical scale, so that we could see the way that the two quantities were related to each other.
Okay,
But it means, ultimately that yearning motivation is really coming from our brain.
A couple of quick questions. Nucleus accumbens does what normally? What is it known for?
So it's a part of the basal ganglia, is sort of the country, the neighborhood it lives in. And it has a lot to do with reward learning. So what we mean by that is this is a region that helps us to understand, oh, I want that. And so it can be, I want chocolate, or I want beer, but this also is related to, I want this person. And that's sort of the connection, that motivational state is coming from that area.
So I know you're giving wonderful answers, and I'm learning from these are not pieces of information that I have. But what I'm also wondering is if they had to describe what that yearning sensation was like. Do they you ever have them do that, or that's not a part of what you go after?
Yeah, because we want this standardized version, they all get the same question about how much they're yearning. And that yearning, comes you can describe it in a few different types of sentences. That wanting them to be back, that feeling that you everything would be okay if they were with you again, those sorts of descriptions.
Are there, I think what Michael, you might be trying to get at is, have you discerned any physiological correlates of that, like in the sensory system of yearning? Because when we're, I think all of us, when we're working, we're encouraging the people that we're working with to anchor their linguistic explanation in their somatic experience. Like what does that feel like to yearn? Where in your body? Do you have any kind of sense or data or personal experience or listening to people, like, because I think it's an interesting question, Michael, where I was trying to think about it for myself. Where in me how would I describe yearning? It's really not easy for me to put into words. Like I know what you're talking about, but
It feels to me like a tight pulling sensation uh, right underneath the sternum.
Yeah, I think, the amazing thing about grief is it is very physical usually. And so that yearning may be experienced differently by different people. Of course, when we work with our clients, it's sort of eliciting from them where they feel it.
Sure.
So if I use the sentence, for example, one of the questions that we say is, tell us how much the feeling of wanting is so strong that it's almost indescribable, which is funny because that's exactly what you're talking about.
That's interesting. Mhm.
So because we know it's a motivational state, I think you are right that that sense of sort of being pulled toward or wanting, to move toward that person. I imagine people will experience that in different places. I sort of experience it like reaching out to hug, that's the place for me.
Yeah.
But it's going to be different, isn't it, for each person?
Yeah.
What would if they then felt the hug of this or could hug the picture, what would they feel then?
I
See if-
don't know. Isn't that an interesting question? Yeah. Yeah, I think, these were not therapy clients, so these were people who came in
No,
once.
non-therapy clients.
Right.
Sure. Okay.
I'm curious if, when we think about grief, I think we're often referencing death, but when I think about all the clients I work with who are going through a breakup or have lost somebody, they've been rejected or abandoned by somebody. I mean, do you see this? I don't know if you've even done that work, but do you see the same thing in the
Yes.
scanner?
Yes, it's interesting. So we haven't done well, let me put it this way, to back up just a little bit. It's funny, when you think about grief, you first have to think about love and bonding, right? Because it is the relationship that happens and then something changes.
Yes.
And so we know that same brain region is actually a part of that bond, the encoding of that bond. And we do see that in romantic relationships in the scanner. We see women looking at a photo of their infant or fathers looking at a photo of their kindergartner. These are 3 studies that we've done. So we know this region is involved.
Same thing.
Yes, so the same general neighborhood
Yes.
is involved in each of those bonded relationships that we also see when the bond has broken. Now, we don't have a study of divorce per se, but we do have, but what's interesting is we did a study using those same descriptions. I gave you the description of one of the sentences they say is that we ask them about is, how much do you find you're wishing that things could be the way they were when you were with your loved one? Well, we made the scale so that it could apply to the loss of someone through death, a divorce or breakup, and also homesickness, right? Which is, you have yearning in homesickness, but it's not for a person exactly. It's for the whole being in that place. And so we used actually the same question. So for example, the reciprocal question was, how much do you find yourself wishing that things could be the way they were when you were in where you're from? And so by doing that, we could see that this experience of yearning was actually quite similar in bereavement, in breakup, and in homesickness, although the amount tended to vary. So we had a much more intense yearning experience with bereavement. But nonetheless, it is interesting to think that the brain is sort of encoding those in similar ways.
And
So-
does the intensity of that vary a lot, obviously, by person and by situation? And
Yes, it certainly does. And, we look for patterns in it, of course. Everyone is having such an individual experience, but as scientists, I guess we look for the patterns. And one of the things that was very interesting was you could see in the breakup sample that it depended who initiated the breakup, right? So if the other person initiated the breakup, that was the highest yearning we saw. If you initiated the breakup, there was often still yearning, but less. And then actually, if it was sort of mutually agreed upon, it was sort of somewhere in between. So it gives you sort of a sense that it is, it's a readout, right? That we can actually describe, that we can actually intuit.
So, Mary Frances, I'm interested in you helping me out with a phenomena that I encounter often. So the phenomena is that when I'm working with someone who seems to be carrying unprocessed grief from a loss that they never had. So what I mean by that is, say, I'm working with someone whose father was killed in the war when they were an infant. So the loss is not, it wasn't an attachment that then, like as you were talking about, was severed or broken, that they can say, but there always feels like that there's this grief over the lack of attachment. And I don't know exactly how I would conceptualize that, but they always seem to carry a kind of unprocessed grief for the attachment they didn't have.
Mm-hmm.
Does your research shine any light on that for us clinicians that are trying to figure out how do we help people who clearly they seem to me like they're stuck in grief for most of their life because there's a missing element that they didn't even know that they are missing, but
Mm-hmm.
it's yeah, you can
Mm-hmm.
see it's kind of murky.
Yeah, no, I think of it this way. So in our mind, we have internal representations, of course, of everyone in our life. And then, of course, we have relationships in the real world. And when a loved one dies under normal circumstances, we have had both that internal working model and the external experience
Yes.
of the person. We know that with continuing bonds, we often then maintain that relationship internally with the person that we loved. Well, I don't think it's a huge leap to imagine that we could have an internal relationship, an
Presentation,
internal
yeah.
representation
Yeah.
of a person, even if we didn't know them. So there is actually a neuroimaging study where we were looking at, I was not a part of, I didn't conduct the study, but it was women who had infant loss or fetal loss prior to birth and miscarriage, and they were able to, they of course have these internal experiences of the infant
Yeah.
long before they're born. I mean, the moment that you want a child, really, you start that
Yeah,
relationship.
yeah.
And so I think it probably works in a somewhat similar way, that we know there is a relationship that could be there,
So they're
and we have that
imagining,
internal model.
in some way they're imagining the missing attachment, like
Yeah,
whether it's positive or negative, in some way
yeah,
it's imagining
absolutely.
an internal representation. And then
Yeah.
is there any suggestions for how you then work with that in terms of someone who, and then I also wanted to get, and maybe before we go into that, in the book, you talked about something that I thought is very important for us, is that the kind of the distinction between grief, pathological grief, and depression.
Mhm.
And if you could say a little bit more about like the overlap and the distinguishing aspects that you found in your research and in your clinical work about
Yeah.
depression and
So I tend to use the term prolonged grief. That's the diagnosis that's been accepted now in the DSM-5 TR and in the International Classification of Disorders, the ICD-11. So we know now that prolonged grief and depression are not the same thing, that they are distinct. One of the easiest ways.
when did we learn that?
So research in this area has been going on since the late 90s, and and has dramatically increased, in the past 5-10 years. And the way that we know that is a couple of things. One, I think the fastest way I've been able to describe it is yearning is not a symptom of depression. Right? So
Right.
prolonged grief is about the person who died. It is about the loss of that person, even if it's about the loss of your own identity in relation to that person, right? But it is very focal on that person or that loss. Depression, as we all know, usually has a metastasis to everything in our life, doesn't it? Right? The mood is there all the time, not like waves of grief, but it's just constantly in the background, and the feelings of guilt and rumination and all of those aspects are not just about a single situation. Now, the important thing is, of course, you can have both prolonged grief and depression. Of course, just like you can have depression and anxiety, right? They can be comorbid, and probably are maybe 50% of the time, our research suggests.
Uh,
But here's a really important data point, I think, which is that in randomized clinical trials where they were doing psychotherapy intervention for prolonged grief specifically, one of the arms of the trial in this particular study, they also gave antidepressant medication. And what they discovered was if the person had depression, the antidepressants were helpful for those depression symptoms. But if they only had the prolonged grief, antidepressants did not help.
yeah, I thought that
It
was
didn't help with
fascinating. Yeah,
yearning, right?
yeah,
And
yeah.
so this suggests even at the level of sort of the neurochemistry, those may be
Different data.
differentiable.
Mm.
So this is like jumping, light years. But so how does this inform people who are treating someone with, great, unbearable grief or very
Yeah.
strong grief that's really disrupting their life,
Yeah.
dragging
So
around?
we have really good evidence now for the kinds of treatment that are effective for someone who has prolonged grief. So we have some very good trials of what is prolonged grief treatment. What used to be called complicated grief treatment, historically in the past decade or so, the name sort of shifted. But so Kathy Shear at Columbia University developed this complicated grief treatment, prolonged grief treatment, that has been supported by 3 NIH-funded RCTs and is about 70% effective. So that means that even if people have had prolonged grief for 10 years, that 70% of them actually develop decreased grief severity, but also are able to sort of restore meaning in their life. We also have studies that show that grief-focused cognitive behavioral therapy has been shown to be very effective. And interestingly, there's an exposure element that is really important, it turns out. That is that, at some level, most of us are kind of avoiding the reality that this person is actually gone. That is such a painful experience for people that they do a variety of things to sort of try and keep that out of their awareness. And so with exposure, you can actually, once you have a therapeutic relationship, you can actually have them tell you the story of what happened when they realized this person was really gone, which is often when they died, but occasionally is sometime later, right?
Yeah.
To have them tell that story and then, to record it and listen to it, to tell it again and again until they're able to sort of regulate their emotions so that the wave comes and the wave recedes, right? Turns out to be often an important part of the process.
That is very interesting. There was another scientist on Ira Flato's Science Friday a couple of weeks ago who was speaking about, she was speaking about the research that shows that by labeling how you feel, it actually is helping you to process the emotion, so that just being able to talk to someone about your grief and put it into words
Yeah.
is part of the processing. And I
Yeah.
think most of us therapists always believe that, but now there's some evidence from neuroscience that says, yes, when we say, boy, I'm just so unbearably sad and I can't, that it just being able to do that just helps.
Yeah.
Honestly.
Well, and I think often as clinicians, clients are telling us a lot about how they feel right now, how they feel sad or yearning right now. But we often don't go back to the time when they actually realized that the person was gone. We don't often actually ask them, what happened when your loved one died? Or after the first sort of consultation, we don't really ask anymore. And often that experience, there's something in that experience that they're really trying
Yes,
to
yes,
avoid. And
yes.
so that can be very useful.
You describe this sensation of having the yearning of having, could be one thing or another. Okay, so sometimes I try to get people who seem really stuck with yearning, and all they can do is think of how much they've lost and they'll never have it again, to imagine having them again, and if they or having a friend who has a similar problem and who is feeling this yearning, and if they or the friend could imagine what this lost person would feel if they knew how much you missed this person and was pain about it. And they say they feel good if it were. And how would you feel? I'd feel good. And I feel a little better right now. So you recast this memory as the good memory. And when you get the yearning, you think, but I still have these good memories. And it lessens the burden.
Yeah. Yeah.
So if I could interrupt, we have a question from Ken, and he's wondering about the differences amongst those who experience grief for the first time and those that sadly experience grief more often.
Yeah. This is such an important question. The idea of multiple losses, I think, is really only just, at least in the research world, grief research world, I think is only really just starting to get attention. So you can think about it two ways. On the one hand, I describe the idea that grieving can be thought of as a form of learning, right? We have to learn that the person is really gone. And also, what does that mean for our life? What if we were going to retire with this person? What does that even look like now? So there's a lot of learning. What I think is interesting is if you have had a supported grief experience where you were able to learn through that experience, gosh, I'm stronger than I thought, or people are really good to me when I'm at my worst, or life is precious, right? We have to seize the day. If those were the things that you learned when you had a loss experience, then when you have the next loss experience, you're probably more likely to have a lot more resources as you go into it. This feels awful now, but I know that before I was able to sort of put my life back together. I think what becomes really problematic is when losses happen too close together, so that you don't really have enough time to understand what the first loss means for your life when you're suddenly dealing with the next loss. And it can end up meaning that you sort of start confirming biases about the world that are not so healthy, like everyone leaves me, or life is meaningless and pointless, right? Like you just die, and so I think it really has to do with our ability to really have enough support and resources to come through it with good core beliefs about ourselves
So
and the world.
in a way, one of my colleagues talks about exercising those psychological muscles.
Yeah.
That if you've had some experience exercising those muscles, when it happens, you'll know that that grief circuit actually is healing, right?
Yeah.
When you feel it fully, and you were talking about waves, which I think
Yeah.
we always see in grief. It's a wave phenomena.
Yeah.
And I often tell my patients that it's like you're on your surfboard and you just have to let the wave bring you up and bring you
That's right.
down.
That's
And
right.
it feels unbearable, but it's a wave-like phenomenon.
Yeah.
And that is
And
different from depression, isn't it?
it
Mostly.
is, isn't it? And
Yeah.
I think the other thing is that for many people, when they first experience really deep grief, really
Mm.
bereft loss,
Yeah.
it is way more intense than they are expecting. You know, you can get into your 40s and suddenly you have your first really deep loss experience. It's intense. You feel crazy. You feel, you know, you do things that you weren't expecting. You can't eat, you can't sleep, you know, all
Yes.
of this, your heart rate is up. And so I think for many people, it's much more intense than they expect. And they feel like it's not normal,
Oh,
right? We don't talk,
that's a really
yeah,
important point you're making.
we don't talk so much about what grief really feels like. The fact that you sort of think you see them in a crowd, you think, oh my gosh, am I hallucinating? Am I psychotic? You know, but this is actually a very common experience. And so I think part of it is that once you've been through it once, to the degree that you were able to absorb, oh, this is a normal experience, even though it's so intense, the next time it happens, then at least you feel like, okay, this is a little bit familiar. I know what this is, even if I absolutely hate the feeling.
Well, and I think
I
that
know- Go ahead.
knowing that you're going to get to a different point, right? Knowing that the intensity is going to at least change. Maybe it doesn't go away completely, but that it's going to at least change over time is so helpful.
Yeah. I think this is where distinguishing between sort of grief and grieving is really important, even though, of course, we use those words interchangeably in regular language. But, you know, grief really is that wave, right? It's that moment of the feelings and thoughts and it means that it's just the natural response to being aware that something so important is missing. Grieving, on the other hand, is the way, just as you said, Heather, that changes over time. And it means that for most of us, the waves become less intense or less frequent. But even if they're just as intense, they can become more familiar, and we can get better at comforting ourselves in that moment, recognizing what this is. And so it means that with grieving, you know, if you expect that you're not going to feel grief anymore, that's not going to happen. Anytime you become aware, even years after a person has died, you're going to have that natural response. It doesn't mean there's anything wrong with you, because there has been change from that acute grief. And so it's that grieving, that change over time, that is sort of mental health.
One of the things that I learned when I was in training was that the capacity to experience dysphoric emotions is a mental health resilience sign.
Yeah.
That if you have a low capacity to experience your emotion, you're much more likely to have problems with tolerating strong affects. And what can be stronger, as we know, looking around the world right now, what can be stronger than kind of horrific grief that we see everywhere? And then the other question is, what do you think about, I know you're not a sociologist, but what do you think about us as being a death-phobic society, that we don't talk to kids about it, that we kind of try to deny it as much? I remember, well, I don't remember, but when people died, in my parents' generation, they would have the viewing in the house,
Mhm.
and death was, and so now we're so detached in a way, and we don't talk about it. And what do you think about, how much of a contributing factor is that to our intolerance of grief and loss?
Yeah, I think it also makes us afraid to talk with people who are grieving, right? Because we don't want to make it worse, and we don't really know what they're feeling. And so I think it is clear that, you know, as cultures go, as periods of history go, there's variation in how much avoidance there is. And we have sort of medicalized it and, you know, put it behind closed doors and funeral parlor doors and so forth. I live here in the desert Southwest, about an hour from Mexico, and you can really feel the influence of Dia de los Muertos, the idea that every single year, right, you all come together and you talk about your loved ones who've died, and you make their favorite food, and there's this sense that it is a part of life. It is a part of what's going on. Those absences are present for them. And so I think what's interesting, though, I first started teaching psychology of death and loss as a course in 1999. So I've seen, a fair number of years now of sort of our cultural experience. And what's interesting is it is becoming more and more acceptable to talk about it, to think about it. The number of podcasts and websites and meetup groups has really exploded in a way that I just did not see in the early 2000s.
And that's positive.
I think so. I think our capacity to, because I think for me, in that moment when you're feeling utterly alone because this person is no longer with you, one of the only ways to get through that is to recognize how universally human that experience is, that your aloneness is exactly something that someone else can share.
Well,
That
don't you think it triggers our most primal abandonment feelings when we have a loss? Like, we evolved to avoid abandonment so we could survive, and when we feel that loss, the abandonment is so at the core, it's so intense. It feels like we're not going to make it, right?
Yeah, absolutely. And I think this is also encoded really deeply in the brain. We need our loved ones as much as we need food and water,
Yes,
right?
yeah.
I mean, genuinely,
Yeah.
I know that all of you had an attachment relationship because you all survived to adulthood,
Yeah.
So I think that's part of the intensity, that it is so basic that we need people. And I
Mm.
think part of what happens is, I was talking before about you have sort of this internal representation of the person, this internal avatar, right? And you have the external relationship. And when that person dies, it takes our brain a long time to catch up. So we are still predicting that they are in the world because when our loved ones, when we have living loved ones, we have to be able to be away from them and know that they are in the world and they are there for us and they will
Object
come back.
constancy, right?
Exactly. We have to believe that to survive. And
Mhm.
so when someone dies, there is a period of learning where your brain is still saying, your attachment neurobiology is still saying, they're out there for you. You should be
back.
reaching out, or why aren't they getting
Coming
back to me?
home, right? Yeah.
Yes, exactly. So there's either the feeling of blame and anger or incredible guilt. Why aren't they coming back to me? Not that this is in any way logical. You can
Yeah.
also have a stream of consciousness that has the memory that they've really died and you haven't lost your mind. It's that you are still responding implicitly to this working model, this belief that they're out there. And it takes a long time to reconcile those two pieces of information.
I
How
had,
long time would you say it usually takes?
I think that's such an individual thing. I think that it,
What's the,
you know,
what is this? Is it like a bell-shaped distribution or?
yeah, probably. And I also think it depends on what you mean by, right? Like, it's sort of like I say jokingly sometimes, when did you get over your wedding? Right? Because that's not a question that makes any sense. When did you get over the loss of your spouse? So I think I think it also depends on what we mean by, the length of time. So
Yeah.
I think if people's waves of grief are continuing to decline in intensity and frequency, and if they are beginning to engage in the other meaningful parts of their life, engage with their other living loved ones, then that to me is mental health. And that just sort of becomes how life is. You are now a person who has grief, and you build a life around the idea that I have grief sometimes. This happened. I wish it hadn't happened. And I am living a life that is nonetheless meaningful and honors the fact that I had this loving relationship.
Do you think that
I,
in my work, the people that I've worked with that have been the most, I would say, the most stuck are people who have lost children.
Yeah.
That to me is just the most unbearable loss for most people, and even for me, sitting with people who have lost their children. It sometimes it just never. I don't think it ever actually really goes away. It certainly, for some people, it tones down a bit. But what's your sense of like, is that the most sort of uh, unbearable loss that us human beings have to?
You know, there's a wonderful therapist that says the very worst possible loss is the one that you're having, right? So it's not really possible to compare them
Wow.
in that way. But we know that the loss of a spouse and the loss of a child are are predictors of the greatest grief severity in general.
Right.
But I will say that part of that is because these two relationships are so bound up in our sense of self that we really lose a part of ourself
Yes.
when that person is gone, right? Am I a parent if my child has died? Can I even think of myself that way? Or what does it mean to be widowed? It's not the same as being married, but it's not the same as being
Yeah.
single either,
Yeah.
right? So I think it's also bound up in how much those relationships are a part of just how we function in the world.
Yeah.
And I think even as a therapist, and maybe this will sound strange to you, but you know, we really have to accept that children die. And that is just a painful and brutal reality. Children die in accidents. Children die of cancer. And I think that it is incumbent on us as therapists to find a way to understand that this is true in order to create the space in which someone else can confront the fact that this is true. And the reason I think that's so important is because otherwise, what many people experience is, what we call the would've, should've, could've thoughts, right? If only I would have gotten them to the doctor sooner,
Yes,
or
absolutely.
the doctor
Yes,
should have known to run this
yes,
other
yes,
test.
exactly.
And I think what happens is when you ruminate about those thoughts, the thing is that each of those thoughts, if you think about it, each of those stories ends with, and then my child would have lived, or then my loved one would have lived. But the reality is that they didn't live. And so there's nothing about whether that thought is true or not, right? It's simply dealing with whether that thought is helpful in coping with the present moment, in creating a life for yourself now after that person has died. So it's sort of like you can't go through the questions, you have to find a way to go around them.
Let me ask you about how our society views the aged,
Mhm.
because that's a reminder that people are decaying and dying.
Yeah.
And there's a tremendous avoidance
Yeah.
often of old people. I live in a community of 55 and above.
Yeah.
And I've been here for a while, and so I've watched how the groups change. And the young people really don't want to have much to do with the old people.
It's
Mhm.
contagious,
Um,
isn't it? We'll catch aging from older
There's
people.
no question. There's no question. And it's tragic because people
Things
are
isolation.
isolated,
Yeah.
and yet they have a world of experiences and knowledge. Often the wisest guy on the block or
Yeah.
wisest woman. So how had you done scans on these people and what it's like for them? Is it already chiming this?
It's very interesting. I don't have any neuroimaging scans in this sort of topic, but I think sometimes we sell young people short. And this is what I mean by that. So I teach this psychology of death and loss class, 16 weeks, 150 students, and it is always oversubscribed. I always have to turn people away. And they tell me they want to think about these things. They want to understand what it means to have a good life, what it means to be good to the people around you. What does that look like? And where is this death anxiety coming from? And they have all of these questions, and to find a way to support them in thinking through those things, looking at philosophy, looking at art, looking at psychology, and giving them the tools to look at some of these things, I find often very much changes. They described to me, I sat with my grandmother over Thanksgiving. I always teach it in the fall. I sat with my grandmother over Thanksgiving, and then I asked her, Grandma, are you afraid of dying? Right? Like, who would think that this was a conversation that was going to come up with a 19-year-old? And so I think there are ways that we can support the integration, but you can't just throw people in. You need to be able to give them some structured way to sort of think about it. That is part of what human culture is supposed to do.
I don't think we do a very good job of it in our country.
Yeah. It depends on the scenario, but Heather, you were going to say something.
Oh, I was going to go back for a second to
Good.
attachment, if I
Go.
may. I remember hearing somewhere, I can't remember the source, don't know if it was a credible source, that people who are more securely attached to their partners, I think that was what it was specifically about, their spouses, had grieved better because they had more of this internalized sense that the person was still there somehow. But then I could see it from what you were saying earlier. I could see it the other way too, where, the magnitude of the loss, how much that feels like a loss to you.
Yeah.
Did you kind of hate your spouse, or did you, really, really, really love them, or your child for that matter?
Yeah.
So I'm just curious what you think about that. Who is it worse for?
So one of the things that we know is one predictor of prolonged grief is anxious attachment. So that, being really consumed with, is this person going to be there for me? And then losing them, we know that that is predictive of poor outcomes. Again, probably in part, it confirms, right, this fear that we've always had. I think with secure attachment, what we're discovering, because there's sort of, is it secure attachment? Is it dependence, right? I think it's hard to sort of label these relationships sometimes. If that person was a big part of how you function in the world, then that's going to be a huge amputation when they're gone. Even if it was a perfectly healthy, wonderful, nutritive relationship, it's still going to be a huge hole. So I think part of what we're learning is it's about how the relationship with that person changes after they've died. And I know that sounds a little bit strange, but it really is about how do you incorporate them into your ongoing life now? And I think people really vary in their ability to do that.
Can you give us an example? Like what
Yeah.
do you mean by
So here's an example that I love to give. Actually, this older man that I interviewed for a research study will always be with me. So he told me a story. He came in and I asked him, as I ask everyone, to tell me the story of how his wife died. And he started way back in high school when he met her, and, how much he loved her, and they got married and they had 2 kids and a dog. And I think there was a picket fence in there somewhere, and then, he told me about her getting diagnosed with cancer and him caring for her. And he got all, teared up, and he cried when he told me about her dying. And that had been about maybe 3 years before the present moment. And he told me that he recently had started going to dinner with a woman who he said he wasn't sure how he felt about her, but she made him laugh, and she brought out parts of his personality that he had kind of forgotten about that were very different from his wife. But he was kind of he was feeling really energized in a way that he hadn't felt in a long time. And he looked at me and he said, the thing is, he said, it was really good then, and it's really good now. And for me, that is the key, to have had that secure relationship and to understand what it means to love someone and to feel grief when you're aware that they're missing, right? And also to be able to then share that love with someone else as well, right?
being the moment?
Exactly, exactly. And so to me, that's the part that secure attachment can sometimes give us, is a sense of I'm going to be okay, although it would be much better if I was with
Yes.
them.
Yeah.
And also, I have an expectation that there might be someone else who I also can be with. Not necessarily a romantic partner. A lot of women started to go with travel companions, right? Friends that they just had a hilarious time with. So it's not that it has to be a romantic partner, but someone to fill those attachment needs.
Mhm.
I want to say one more thing about attachment, if that's okay. I
Please.
think this is, I think this has really helped me to think about how our separation response is bound up in attachment, and then how that relates to bereavement, to grief. So, when John Bowlby talked about attachment, he was talking about this process, right? Like in the desert Southwest, I think of the little quail, the little bird, that has the feather, the little baby quail that are following along, and it's like that invisible tether, right? That connects them. When we are separated from a loved one, the first response that we have is protest. Wait, what? No,
Yes.
they're gone.
Yep.
And it's very energizing. It's like you look down and your toddler's missing in the grocery store, and all that feeling that you can now imagine, that is protest. Wait, what's happening?
Yep.
Where are they? That is an important not stage, it's not the right word, an important response that we have to separation. And we have that, of course, when a person dies as well.
Mhm.
And then there's another response that we have, which is despair. And despair is, oh no, they're really gone.
Oh, that's interesting.
And that is a very withdrawn, unenergetic response that we're having. Well, if you think about it in sort of how this evolved, of course, protest was incredibly important. Hopefully you would find them again, right? And then at some point it became important to conserve your resources, right? If mama's not coming back, I better sort of shut down.
Yes. Yeah.
Or if I keep searching, some predator is going to come get me,
Yep.
right? And so there's this despair response. But what I think is so important is, I think this continues to be important even now in sort of human grief response. We have to allow people to be in protest. We
Yeah.
have to allow them to be like, this shouldn't be
Yeah,
happening.
yeah.
And also we have to support them in, this is unbelievably terrible, and this is going to destroy me, because that is a part of realizing the reality that they are
Yes.
gone. That despair actually stops protest, right? Despair actually allows you to believe that it is true that they are gone. And I think supporting people in that despair moment prevents them from going back to protest, right? If they feel like, oh, I
Yes.
can't
Yeah.
stand this feeling. But despair is, of course, not the end either. There is acceptance, where despair says, oh my God, they're gone, and I am never going to feel differently than this. And acceptance says, oh my God, they're gone, and I'm going to find a way to restore a life that still makes sense to me, right? So there's this hope and optimism that comes with acceptance that doesn't come with despair, but it doesn't come right away. It's okay to support people in that despair, I think, because it is part of accepting the loss.
I think what you are talking about is so fascinating. I am thinking about Ed Tronic's still face video. And it's exactly what happens in the still
Yes,
face video.
that's right.
The protest of the kid,
Yep.
then the collapse.
Yes.
But in that case, the mother repairs
Right.
and the child comes back online.
Right.
But in the loss, in the immobilization response,
Yeah.
the failure to thrive syndrome that
Yeah.
Spitz studied.
That's right.
I never thought about that in terms of the grief. Very
Yeah,
similar.
I think it's the same process.
Yes.
And we know that our attachment neurobiology is flexible enough, that our brain is plastic enough,
And
that we
accommodate.
can find others who will fulfill our attachment needs, right? I mean, we partly know this because there was a time for all of us when a caregiver was the most important attachment relationship in our life. And then fast forward some number of years, and it is a peer, a partner, who is the most important attachment figure in our life. So we know that attachment neurobiology is flexible enough to recognize now is the time that this is the person who I turn to when things are bad or things are good. And so it is possible, even after tragic loss, to come to a point where we can renew or acquaint ourselves with new relationships that make us feel special and make us feel loved and that we trust. But it's going to take time and experience.
So what does that say about the therapist, how they deal with this? Because they're just human as anyone else. They have
Yeah.
just as many unresolved issues around loss.
Yeah.
And the patient comes in. How do you
Yeah.
work that into the picture? What
Yeah.
advice do you have for therapists about what they can do to help people with loss better?
Yeah. I sometimes think about it as it's kind of a yes and. So, yes, I support you in that shouldn't have happened. It's awful. That's wrong, And also, it is the reality that we have to deal with now. Or in despair, if you recognize that, you're right. This is unbearable. It absolutely is unbearable. And also, there may come a time when it feels more bearable. Right now, it feels unbearable, and I am right there with you. It's the worst you've ever felt. And also, there may come a time where you're able to carry that absence and also be with others, right? And so I think it's always supporting where they are and also giving them permission to move through that experience and to restore a life. And often people need really specific, encouragement, so you're avoiding going out to dinner with your couple friends because your wife has died. What if we actually do that? Let's see what that's actually like. And yes, you are going to miss her terribly, and it's going to be super awkward. Let's try it anyway, right? Like sometimes the avoidance is so strong that our role as therapists is let's confront the reality, right? And then let's get together and let me support you through what that experience was like, because that's the only way to learn how life is now, is to be a part of life.
And we have time for one more question.
Oh, I have a good one.
Good.
Unless you have one on the screen, Jeffrey, is there
No,
somebody
no,
else?
you got
So
it.
my question is, what is it like just as a person to be immersed constantly in this topic of death and grief and loss?
It's so interesting you say that. A lot of people say to me, you are way too happy to be doing this work. And I think, no, that's exactly why I'm this happy, right? Like, I am constantly confronted with, yep, this is it. This conversation we're having, this is all we get, And that makes you truly enjoy having this, it means a lot to me to share these ideas with you in this moment.
When you
I
when
will.
you when you leave the office
Mm,
and go into normal life,
mm,
it's kind of empty compared to what you were going through.
mm.
But
Not for me. I mean, I get what you're saying, but for
no,
me, it feels just as rich. I mean, I think partly because that's my own work, right? Of sort of having confronted losses in my own life. But I will say it can become a lot. I talk a lot about grief, and it feels wrong not to be in the feeling of grief if I'm talking about it. And so I have a colleague who had a baby, and I literally babysit that child every weekend because babies are like the anti-grief, right? I get to take care of a puppy after Christmas because a friend is going away, right? You got to have puppies and babies in your life, as well as discussions about grief and existential loss.
Mary Frances, thank you so much for sharing your wisdom, your expertise, and your enthusiasm about working with people who have losses. We're going to stop our recorded version, and we will talk for a little while for those of you who are wanting to hang around and be with us for a couple more minutes. So thank you all for joining us today, and we'll see you next month. Bye now.
Anybody